වුහාන් ගුවන්තොටුපළ වසා දැමුවේ වෙන කිසිම කාරණයක් හින්දා නෙවෙයි.
The Wuhan airport was shut down as the virus could spread when planes enter or leave the city. We must be thankful to Sri Lankan Airlines and its team for coming forward during a crisis like this. The team of 16, including pilots and staff, took over the responsibility on behalf of our children. In the past, some factions spoke of selling the one and only national carrier of our country, Sri Lankan Airlines. If the airline was sold, we would have been severely inconvenienced today. In my view, all citizens of Sri Lanka must respect and commend their efforts. We are thankful to the brave team of Sri Lankan Airlines.
කරන්නට උනේ නිර්භය ගුවන් සේවක කාර්ය මණ්ඩලයට අපි ස්තුතිවන්ත වෙන්න.
Meanwhile, the Director General of Health Services said the health condition of the Chinese national who had been diagnosed with coronavirus in Sri Lanka has recovered.
It has been confirmed now that the Chinese woman who was tested positive for the coronavirus has recovered. The virus has been sterilized. As per the medical test yesterday, she can even be discharged. 16 individuals suspected to have been diagnosed with the virus are currently receiving treatment. 10 of them are receiving treatment at the IDH. 6 of the 10 are foreigners. 2 such cases are currently receiving treatment at the Ratnapura Teaching Hospital, 1 at the Karapete Teaching Hospital, and 3 at the Gampaha District General Hospital. A 3-member committee to report on daily activities at the airport has also been appointed. The committee's operations commenced today. The members of this committee include a doctor attached to the Disaster Management Unit of the Ministry of Health, a member of the Immigration and Immigration Department, and a member of the Airport and Aviation Services Limited.
දෛනිකව කටයුතු කරනවා ඒ ඔව් අනිවාර්යෙන් ඒ රෝහලින් පිට කරනවා.
The University of Hong Kong is currently conducting research on the rapidly spreading coronavirus. The SARS virus was discovered by a team including Professor Malik Piris of the University of Hong Kong. Professor Piris shared these views on the coronavirus with Newsfirst once again.
They have taken very strong control measures in Wuhan and in the Guangxi province. It takes a few weeks for those control measures to have a full effect. It's a pneumonia primarily, but it does appear that there are many more mild infections. Of course, what comes to attention are the most seriously ill patients because those are the ones who go to hospital and who are diagnosed. So of those hospitalized cases, yes, a substantial proportion of them have been severe and fatal. But it does appear that a much larger proportion of infections are mild, and those are not, of course, not being counted. It is probably significantly less severe in fatality compared to SARS, but probably somewhat more severe than seasonal flu. We still don't know exactly where this lies in between these two examples. The first and most important thing is to be alert to people with respiratory disease with a travel history. So you have to first and foremost find out evidence of recent travel, examining the patient. If it is warranted, then it may be necessary to send specimens for diagnostic testing. It's important to take this opportunity to look and strengthen the general routine infection control measures that are present in hospitals. An event like this is a good trigger to make sure that people stop and look and see whether the infection prevention and control measures in the hospital system is robust.
Professor Piris also spoke about medication for coronavirus.
There are some medications that have been found to be effective, at least in the test tube and in animal models, against the MERS coronavirus. And it's a very close relation of this particular virus and of course also for SARS coronavirus. It is very likely that these antiviral drugs would also have activity against this new coronavirus. But that remains to be tested. But in any event, none of these medications have been tried in patients and proven to be effective against MERS or against SARS. So there is no proven antiviral medication. There is a lot that medical care can help a patient with this disease, even though there is no specific antiviral agent. It may not be as severe as SARS, but there are some differences in the pattern of transmission with this virus that may make it somewhat more difficult to control than SARS. However, it is also probably true that it is not as transmissible as, say, influenza is.